Nicole Lee. Before we begin, I would like to review a few housekeeping items. First, all participants are on mute with video off and will remain that way for the duration of the webinar. Second, you may submit questions anytime during the presentation using the Zoom Q&A feature located at the bottom of your screen. Dr. Lee will be answering questions at the end of the presentation. However, you may submit questions at any time. Thank you. At this time, I would like to introduce Senior Brand Manager of Thermage, Heather Santos.
Thanks, Janet. We're so excited to have Dr. Lee with us today. Dr. Nicole Lee is a board-certified dermatologist with an advanced fellowship training in cosmetic and procedural dermatology. She completed her undergraduate degree at Georgetown and then pursued her doctorate in medicine at the University of North Carolina in Chapel Hill, where she obtained a Master of Public Health degree. Upon completing her medical education, Dr. Lee returned to Georgetown for her internship in internal medicine, followed by her dermatology residency at the University of Alabama, where she served as chief resident. Dr. Lee pursued an advanced fellowship training at the prestigious Skincare Physicians in Chestnut Hill. She also completed the American Society for Dermatologic Surgery Fellowship, specializing in cosmetic, laser, and surgical dermatology. Dr. Lee is a recognized expert and at the forefront of innovation in medical and cosmetic dermatology. She has contributed to the field by presenting at local and national meetings, publishing in peer-reviewed journals, and authoring textbook chapters. She's a fellow of the American Academy of Dermatology, the American Society of Dermatologic Surgery, the American Society for Laser Medicine and Surgery, and the Women's Dermatologic Society. Dr. Lee is a sought-out speaker and peer instructor for her creative approach to medicine and natural cosmetic results. Her passion is continued education led her to become a clinical assistant professor in the Department of Dermatology at Mount Sinai School of Medicine, where she works closely with medical students and residents. Dr. Lee's multifaceted career exemplifies her unwavering dedication to advancing the field of dermatology while providing exemplary care to her patients in New York. Dr. Lee, I'm going to turn it over to you.
Hi, everyone, and thank you all for joining me today. So for me, I just wanted to start off kind of talking about why I picked these devices. So I actually just opened my own practice last fall. So I know that for many of us, as we're deciding what to bring on, what to add, what to start with when you actually have such limited funds, a lot of it is deciding, well, what works? What actually can give us consistency? And I think with all the marketing that we're constantly being pestered with on social media and just the various people that come through the office and what patients think they want based on things that they've seen on social media, it sometimes is a little bit hard to decide or choose what is relevant to what your patients actually truly need despite what they're asking, and then what actually works. So one of the things that made me love Solta as a company was really the science. There's so much about the science that then leads to the clinical. And I think we often lose sight of that. Everyone's looking for that fast fix and that immediate results. But I do think there's something about longevity and consistency. And when you have the data that then leads to the devices that are formulated and created, you then have that consistency. You have those results. And then there's a durability to that. And then as devices and technology evolve, if you have the foundation of that science, it's naturally easy to continue to improve and evolve over time together. So that to me was easy when I was deciding, all right, what am I going to pick? I have X amount of money. What is it going to be? And it wasn't hard for me to decide, hey, I'm going to definitely get some of these devices that Solta has because they're tried and true and they work. And they are also just brands in themselves, which also just help when you're starting out and you're trying to just make a name for yourself as well. So as you can see here, just with some of these first slides, we're looking at Thermage. It's been around for over 20 years, right? They have over 50 plus clinical studies, very large and a leading non-invasive treatment option, especially in Asia, but also globally. You've got Clear and Brilliant. They came out with their new touch, but Clear and Brilliant is in itself a brand name. People constantly call my office asking me, do you have a Clear and Brilliant? Do you have this one? Do you have that? And everyone just loves it. And then Fraxel. Fraxel's always just been a household name. And everyone knows that word. They may not understand what it is, but everyone knows what it does. And it's just well known. So just having that in itself really does make a difference as a company and as a provider when you bring on equipment. So today we're really going to focus on just discussing what are these 3 devices, how can we use them, and how they can fit. One of the things that I liked a lot when I was picking equipment is I needed versatility. I needed something that I could do, that I could treat patients of any skin color. We live in a very global society now, so we have to be inclusive and considerate of that as well. I couldn't just do type 1 to type 3. I wanted to go all the way to type 6. And what we'll see and touch on here is how these devices can be used in all skin types. Also, I wanted something that can be used at any time of year, right? So depending on settings and choices, a lot of these could be also done in the summer so that it's not just a season where we do nothing during the summer, but you can actually continue to treat your patients depending on their social schedule and what time they have allowed for you as well. There's also just such customization with these that you can tailor it to exactly what your patients want. I needed to be able to do that, to say that I'm a provider that can give customized results based on what your skin is asking of me. So here we're going to talk about Thermage, Clear and Brilliant, and Fraxel. So just kind of, again, with this slide, just touching on the personalization, the customization. And then in this one, that the inclusivity, right? We can treat of any skin color with all 3 devices. And I do think that that's something very important to keep in mind when you decide what devices you are going to bring on next. So again, touching on the same thing, versatility, Clear and Brilliant, very quick, very easy to do, also does very well. And then Fraxel, again, very well-known brand, very well-known on what it can do. This can be on various parts of the body. You can do eyes, you can do face, you can do body as well. So we'll start with Thermage. So Thermage FLX specifically is their uniquely new version, is a monopolar capacitively coupled RF device. So I think one of the first things to know is that not all non-invasive Titan devices are the same. And not all radio frequency devices are also the same. So this one is monopolar, meaning it goes from the tip to a grounding pad on the skin where the energy is going in one direction, monopolar. Is capacitively coupled RF, meaning there is a heating of the skin due to the resistance that the energy is sensing, right? So with that resistance, you are bulk heating, therefore then causing wound injury and contraction and tightening. It's non-invasive, allowing for smooth tightening and contouring. So with the new device, you can see it's very pretty, it's very slim, so very small real estate, which is really important for places like New York. You just don't have that much space. The device is very easy to go through. The newer version is actually much faster than the older one and even more comfortable for those who've had the prior model. They have a larger tip size that speeds up the rate, which is important when you are, for me, I do all my treatments. So if I can do something 30 minutes faster than I could before, that makes a big difference where I could do more in that same period of time. So like we touched on before, it smooths, it tightens and contours the skin. It can treat any skin type, and it's compatible to really other things that you might do, like injectables, fat loss, a bunch of different other things that you want to do as well. So I think the thing that we have to really touch on with Thermage, though, what makes the FLX uniquely different than the older CPT model is this AccuRep technology. And I do think this is also what sets us apart from so many other tightening devices in a way on the market, right? There is a customization to it. So when we traditionally used to do this, you would basically first, like with all lasers, but in this case, radio frequency, you would calibrate a device. So in this case, you would tune it. So we used to say, all right, one tuning here, and therefore now we've decided that's the way the energy is going to be delivered based on parameters we pick on the screen. But what we do know is that the skin here, the skin on the forehead, the skin around the marionette, the skin in the submandibular area, they're not exactly the same kind of skin integrity. Some areas are a little bit thinner, some have more dermis. Like there's such variability within it that you have to take that into account. And in past other versions of these kind of treatments, you always wondered, why was it not as effective as one would think it would be? So in these cases now, we are actually tuning with every single pulse we deliver, meaning it is truly customized results because it's going to read with every pulse that goes here, what is that skin condition? This is the amount of energy I want to deliver. And then we're going to go here and do the exact same thing. So now it is knowing, all right, in different parts of the face, different parts of the body, this is exactly how much energy I need to give to maximize and optimize the results. To me, that is the definition of customization. So to be able to say that you can do that is incredible. So with the new FLX, you have 4 different tip sizes. You've got the original 3 centimeter, but now you have that 4 centimeter square, which allows more real estate and coverage. You also now have this body tip, which has 4 of these that then can be applied to like larger surface areas for more effective and quicker treatments. And then we also have an eye tip so that you can cover basically within that infraorbital area, but remembering to also, protect the eyes with a plastic intraocular shield when doing so. So I think one of the best things is seeing the before and afters, right? We can always promise the world, but this is how we kind of look at it. So if you look here, you can see that there's just softening and hydration of the creases around the eyes and around that neck area. What we were always taught in our fellowship and how we always looked at thermage was, it's not plastic surgery, right? We're not giving you a facelift. But what we're doing is giving you back that snap back sensation to the skin where you pull your skin and you can feel it kind of retract in. And it's one of those things where you start seeing results instantly, right? That's the immediate heating. And then truly at 2 to 3 months, as wound remodeling and collagen is regenerated, that's when you really see the benefit of that 3 months later to fully at 6 months. And we would always say, repeat it once a year, once every 2 years, kind of on your birthday as a way to kind of change the trajectory of how we are aging in itself. And it's one of those things that it is, synergistic. It accumulates on itself for those who really keep up with it. And they do see the results in long lasting. What is fun to always do is a split face. You do half the face, and then you have them pull the other half. And you're like, all right, pull this side that we did, pull that other side. And you can feel such a difference of just, this one is so much tighter compared to the side that wasn't treated. And patients always love that split face reveal. A lot of my moms, when they come to do this, they actually make it a date night. They get a babysitter, they're going out that night because they look like they've had a hydrofacial. The skin just looks healthier in a way from a crepey standpoint that we never quite touch on, but it gives them an instant glow. And they do kind of see that lasting a bit with that contraction as well. So in this patient, you can see that improvement kind of around that upper eyelid area where you really see just that subtle lifting, but enough that it looks refreshed without being dramatic. And then also just around that lateral upper cutaneous lip to nasolabial and marionette area, just softening of everything as well as under that neck area. Areas that, normally it's a little, they're just starting to see these areas of aging that once you have this, you add a bit of injectables, you get even better results with that. And then here we're highlighting the benefit of treating really that eyelid brow heaviness that starts to occur over time. And then here you can also see that laxity of that lateral upper eyelid where you would think you needed something aggressive or a CO2 or even surgery. It does well also on the body where you look at that neck, that above the knee crepiness, which so many things have such inconsistent results, but this is a no downtime option for people. And then here as well on the abdomen. And then here's my patient actually. So this is a little interesting. So I've had this patient for many years. She's gotten many fillers. She lives on the water, has a lot of sun damage. She's only in her 40s. But what she found was that fillers and injectables just overall did not last on her. It was almost as if she just metabolized everything and it just didn't work. So when I then brought on thermage, I had mentioned, I think we have to change gears a little bit. Let's work on improving the skin in itself. Let's work on making the structure and quality of skin healthier and better and firmer and give it a little bit more of that snap back so that when we do other things, we can get more out of it. What bothered her most was always those marionette jowling creases. She could care less about her eyes, which I actually really love the benefit of it. But like, as you can see here, 3.5 months later, we're already starting to see that improvement, that lifting, that softening of just around that eye area where it just looks more hydrated, even just around that marionette, just that tightening and lifting, and almost where you think you'd have to do like a biostimulatory filler or something along those lines to really pull that skin back. And then now you see her at that maximum result at 6 months, where her skin just looks like it's glowing. And so now I've started working on some filler and some toxins to really start now minimizing movement and augmenting areas that we've had volume loss. And the results have been longer lasting. Her Dysport has lasted longer than it ever has before because we've lost that rippling crepiness within the skin. Yes, she's moving, but the skin is healthier and firmer, so it bounces back like it's supposed to. The filler also works so much better now for her, where she's not coming into me every 2 months asking for more filler to fix the areas that bother her. And these are her eyes. She could care less about this. I love this more than anything because you can see almost as if there's a hydration to that crepiness that I think can be so hard to achieve. And injectables definitely cannot do this on its own, where just the little rippling under that lower eyelid, especially on the lateral aspect, just looks healthier. And that on the inner part too, there's just less creases overall. They just look a lot more refreshed for her. This are some photos of that 45-degree angle for her. And then also on the other side, just the softening, the cleaner appearance, and just the tiny little creases themselves just look like they're less pronounced, and her skin just looks more hydrated. This is another patient of mine that was most bothered by her submentum turkey neck look. And so we really focused that energy on that lower jawline and neck area. I think this is where part of that conversation about expectations comes into play. Again, not a facelift, right? Not a neck lift. But for those who are not ready for that, I often say this is a way to hold off, at least make the skin healthier for when you are ready. Or I have patients that say, I'm never going to do it. So what I can get is enough for me, but there's just overall just a cleaner look, even though yes, you still have some wrinkles. Yes, you have some laxity, but everything just looks softer, smoother, and the patients just feel better about themselves overall. And this is her on the other side. I kept thinking, is she pushing her neck back? But no, it really is actually, this is how she stands at straight up. And that's really just the amount of laxity under that neck area for her. So now we're going to talk about Clear and Brilliant. I think Clear and Brilliant is one of those that is so easy to understand. Everyone knows about it. It is one of my most favorite devices. I actually originally was planning, all right, I only have so much money. I'm not going to buy this. But then I had patients constantly calling my office over and over asking, do you have the Clear and Brilliant? You said, do it for me at your old practice. Do you have it? Do you have it? We loved it. And it has such a high satisfaction rate of just repeat customers that constantly want it because of the low downtime and that glow and those results that you get just from after it, that I had to then bring it in. I remember texting my rep on a Saturday night, a few months into the practice, thinking I was not going to buy another device and say, okay, I have to buy this device. I need to get it. I just have so many patients that want it, and they loved it from how I used to do it in my old practice. But this one is actually the new one. So it is actually more effective in many ways, and we'll touch on that later. But so Clear and Brilliant is basically two hand pieces of two different wavelengths, right? You have the 1440 and you have the 1927. Both of them target water. The 1440 goes deeper to start really resurfacing neocollagenesis, softening of lines, just starting to treat along those lines. Then you have the 1927, where you are more superficial, targeting that sun damage, that photo damage, the pigmentation. And I always tell my patients, these are one of those treatments where just try it one time, and then you'll let me know. It's sometimes hard to say what it is that you'll see. It's not aggressive resurfacing, but it's about just dipping your toe into that world for those who are anxious about doing something and they don't know where to start, but they're scared about the word laser, but they know they want something. So a lot of my patients, it's women that have had their second and third kid and they feel like their skin looks very dull and they're wanting a glow because sleep is not working anymore, right? Or they're just needing that pick me up. And it just has that. You start seeing it within a week and it lasts for months. And patients love that. I have some women that will do a series of them back to back in preparation for large events because it doesn't take so much time out of their social schedule that they feel that they have to hide away. And they can't do that yet because they just don't have time for it. This allows someone in that busy lifestyle to start working on improving their skin and benefiting from it as well. So what's new and unique about the touch version compared to the legacy, which I really appreciate, is that the tips are actually vented, which means for those who've had the older one, you may remember you needed a fan, you would have to remove the tip and sometimes clean off the condensation that would build up. Now you don't have that problem at all anymore. So what this has done and allowed is for treatments to be much faster than before, where you could do an entire CMB in like 15 to 20 minutes. Whereas before it might take like a full 30 minutes to do it. The new device also allows us to use both hand pieces, which is great. So now we can, rather than just deciding, all right, I'm only going to do 1440 or I'm only going to do 1927, now you can give them a bit of that dual. So a lot of times for me, I'll do the majority of whatever I really want to accomplish, like maybe majority of 1440, and I'll just do a little light painting of the 1927. Let's give them a little bit of that, target some of that pigmentation, that dullness, but really I want to focus on rejuvenation. The new device is very cute. It's very small, like a little monitor, and it's touchscreen and it's very easy to kind of go between everything. Very simple to use, very compact. Again, compact matters in New York. So here are some before and afters. Here you can see there's a brightening of the skin, but I do think there's something interesting that we don't really quite touch on with CMB is the background of erythema and flushing. KP rubra is one of those things that is very, very hard to treat. No matter how advanced we become with the lasers available or topicals, we can often improve the texture with retinoids and whatnot, but you can never quite get rid of the vascular, and it doesn't stay, even if you get some improvement. But you see here, there's actually a brightening and softening of that vasculature as well, which I actually really appreciate with what this, because I think it's very hard to actually touch on this. And here, kind of the same thing again. You can see this overall brightening of the skin, but also a reduction of that background of that KP rubra kind of like vasculature as well. That gives a rosiness to the skin. And patients always hate this, and there's not much we can do for it normally. And here you can see the benefit of really that pigmentation and photo damage. And again, that background of pink that you wouldn't normally assume a resurfacing laser would help you. So now we're going to talk about Fraxel. Fraxel's probably has this place in my heart because I love it so much and I could Fraxel all day long. So let's go into a little bit more detail. Fraxel has also two wavelengths, right? You've got the 1550 and you also have the 1927, but obviously much more powered. And for both of these, again, the target is water. So this is a non-ablative resurfacing laser where you basically have columns of heat going through the skin without damaging the surface of the skin, that stratum cornea, but targeting what you intend to target. So the 1550 goes much deeper, whereas the 1927 is very superficial, again, at that DHA junction, so targeting more pigmentation. Like we talked about, you're getting these tiny little columns of heat of MTZs that basically are causing that microthermal injury, allowing you to resurface without causing too much damage so that the healing process is much quicker. And patients can easily, again, schedule that within their work week. It's about a week of downtime for most people. But what I love about Fraxel is, again, the customization. You can really dial down a treatment based on what a patient's downtime allows or what you're trying to accomplish, or really dial it up if you're really wanting some crazy true resurfacing and really targeting that photo damage. It's just, you can do what you want with it, and I love the ability to do so. So this is, again, just talking about the two different wavelengths that are in one fiber, and you can just pick and choose what you want to do. In this slide, we're looking at kind of the depths that I was talking about, where you really kind of use that 1927 for that photo damage. I look at it as a way of kind of power washing a garage that has that dullness and that dirtiness. And you don't realize just how dirty it was until you got rid of all of that. You're like, wow, look how white the door really is now. I look at the 1927 kind of like that, because pigmentation so much, when you have it, can actually give the illusion that you have much more wrinkles than you truly do. You have much more texture than you truly do, or enlarged pores than you really do. And as you eliminate that, the skin in itself looks just much smoother. You have the 1550 really then going deeper, that then is targeting really texture, wrinkles, scarring, real rhytids. with that recent paper that was released by MGH last fall, we're seeing even the medical benefit of targeting non-melanoma skin cancers as well as actinic damage, which adds a whole nother element of just benefit to using this device. But I think it goes back to really the foundation of the science again here, right? This device was made in a way that I believe there's so much more that we don't even know what it can actually accomplish, and we'll know that over time. So here's what the device looks like. You've got the console, which is that box on top, and then you have a cooling Zimmer that comes with it to push cold air to make it more comfortable while you're basically using the laser. And as you can see here, the Zimmer is attached directly to the handpiece and is blowing onto the skin, which you can then turn on a higher fan level or turn it down depending on what you're doing and how comfortable the patients are or not comfortable and wanting more cooling. I like the fact that this is attached. Some devices, you need a second person to hold it. I like to be efficient on my own and not require my staff to always be assisting me with everything. So if I can just be on my own, do this takes me, what, 5 to 7 minutes to do a Fraxel to the face. It's very, very fast. And then I can go from room to room. This is touching on kind of what we had mentioned before about just the various utilities or things that you can target by these wavelengths, right? You got the 1927 for that actinic damage, the superficial pigmentation, that photo damage. Then you've got your 1550 to target texture, rhytids, acne scarring as well. And you can do the combination of both depending, again, what you're trying to achieve and accomplish. So my patients will often tell me, all right, Dr. Lee, I can do X amount of downtime. And then I will dial the settings down saying, all right, I can only do 3 days of downtime for this patient, and that's what we'll do. Or they're like, give it to me, I'm gonna go hide for the next week out east, and then you just dial it up with just more energy overall to bulk heat and give them what they can. This photo, I think is a really good starting point because many people often think Fraxel is something for old people or significant photo damage or someone that really needs real resurfacing. But you can see there's benefit even to younger people, where there are some of those that just have pigmentation at a very young age, even as children, just because that's the way their skin is and that's how much sun they've had. Where you can see the difference of doing just the 1927 of just targeting those lentigines, those freckles, and just how much younger and more refreshed the skin looks. It glows on itself. My patients love it because they often say, I don't need foundation. I just need a BB cream and I'm good to go. And for women, that is often a really important thing to be able to have. That's why we do our hair. That's why we do our nails. That's why we do our eyelashes, right? We don't have 2 hours every day to look put together. And at a certain point, life gets hard. So you want to be in and out. So to do something that can keep you there and maintain that, make you feel refreshed, make you feel good about how you look, and just have some sunscreen, a little eye, a little lip, a little cheek, and you're good to go, is like an incredible thing to offer someone, because you get so much benefit from that. Here's someone that does have more significant, obviously, sun damage with that pigmentation and melasma as well that can be targeted by the Fraxel. And then someone you can see here, just like how drab and dull that skin looked, and by eliminating the pigment, how much better the skin appears. But then also by doing that deeper setting, you're seeing that the skin looks like you've had filler. So I've had patients, I've done a lot of acne scarring treatments that look like I have, after doing 4 to 6, that they've actually had filler into the cheeks because we are creating collagen, right? Neocollagenesis does this in all ways. Here's an example of someone with acne scarring and how you're softening. What we always say is you're never going to get 100% get rid of acne scarring. You can't get rid of scars, but the goal of treatment can be to soften and make the skin look much cleaner and smoother overall so that it's not the first thing you see when you walk into a room. So this is a patient of mine. It was a very interesting consult. So she was someone that had come in and said, Dr. Lee, I hate this big brown spot on the top of my face, but I just don't like how my skin looks. I've never done anything. Can you please help me, help me get there? So we talked about Fraxel. We talked about a bunch of other things, but really it seemed like the complexion and her skin texture is what bothered her most. So I had said, let's start with just the 1927. Let's work on your pigment and see how much of the rest of the lines on your skin still bother you. So she scheduled it on the way out. And then I start getting these voicemails and these phone calls of, what am I coming in for? Wait, what's going on? And she goes, what is this? And then it turns out, and I go, something's not right. Cancel the appointment. Make her come in for another consult, and we're going to talk about this again. She doesn't remember anything we said. Turns out she basically had taken Ativan prior to my appointment because she had an MRI and completely forgot the entire visit, kind of knew she was there, but didn't remember anything about it. So we had to redo all of that. So like true consenting, truly going over everything again. But you can see now after she had it done, she absolutely loves it. And so for her, she's like, yay, the brown spot's gone. I was like, well, do we appreciate the rest of your skin? But you can see that just by getting rid of just with one treatment here of the 1927, just how much better her skin looks. It just looks healthier. You're not needing to hide this anymore. And she actually looks like she has a lot less wrinkles because so much of it was enhanced by the pigment in itself. And here's just another photo also demonstrating that as well. This is an old manager of mine who had had acne that was made her so insecure since she was in high school. 3 rounds of Accutane, constantly covered with such thick, pasty foundation every day. And then she was getting married. So she had asked me, like, how can we better manage all this? So I'm always trying to talk to my patients about wearing less foundation on a day-to-day basis. Let's keep our life simple every single morning. Go with that more natural look. So we optimized her acne routine, targeted some hormonal aspect of it, and in preparation for her wedding, we basically did 6 treatments of the 1550. And you could see just how much softer and cleaning her skin looks. Like areas that are a bit more like hypertrophic, and then you've got some of that atrophic aspect that added that illusion of this like rolling valley texture to it. It's just much smoother now. And then you can see even in that marionette area and her cheek height, it almost looks like I did filler. But I didn't. This is all Fraxel because that's what it can do in the long run. And what I mean about my acne scarring patients who've done tons of these, they look like they've had filler. The skin looks just smoother and more voluminous as well. So that's basically that's it for basically my presentation. But the things that I think to take away from all of this for what I had looked for, and each of us, it can be a bit different. I do find that there's a large stigma now, right? There's a taboo about injectables. There's a taboo about looking fake and done and overfilled. We're seeing it with Hollywood. I'm seeing it with all the fillers that I'm constantly dissolving for the new consults that come in the door that have been filled for so long. They don't even look like themselves anymore. So given that hesitation, I love to talk with my new consults and my old patients as well, just about, well, let's do what we can to optimize your skin. Let's make your skin healthier and firmer in the best state it possibly can be so that the one day when we do injectables, we actually get better results. We don't need as much. We need less to really keep us where we're at. And I do find that the patients are very open to that because they like things that are more long lasting, that don't require so much maintenance and so many visits to maintain. For those who do ultimately get plastic surgery, if your skin is firmer and healthier, the surgery also looks better. It's easier for the surgeon as well because it's not so thin that you're seeing every stitch. So that's basically it for me. I think we're opening it up for questions now.
Yes, thank you so much, Dr. Lee. It's so helpful to hear not only just about the science behind the devices, but also why you chose these devices to build your practice and the success that you and the results that you and your patients have seen. So we have a bunch of questions coming in. You talk about the fact that these treatments can be done year-round, all of them. Do you have any guidelines when it comes to each of these devices and how they can be done year-round?
So I think Thermage is an easy one. There's no downtime. There's nothing you really need to do to prep for it. And like I said, it's kind of my date night treatment for my patients. The moms will plan and they'll get a babysitter and they're going to go out in town because they know they look good. So that one you can simply do any time of the year. The Clear and Brilliant is also such a low level resurfacing with such low downtime as well, just some blotchy streakiness for about 48 hours and roughness for the week, that you can easily incorporate that and go back to your life. It's just about good sunscreen. Fraxel can be done as well. I think it depends on kind of lifestyle, right? So I used to say for those of us in New York, well, what if we lived in Miami or LA? It's sunny all the time. and when would they resurface? So I think it's about planning for it, where I have some patients that can only do it in the summer because they're either home from college or they're teachers, and their lifestyle's too busy during the school year with events and just social and professional things. So what I'll tell them is, let's do it, let's prep for it, but we're going to protect very well after the fact that week. I'm going to ask them, please don't maybe go to Cancun that week or go on a boat trip, right? But let's just, wear your hats, your UPF clothing, and then a lot of sunscreen and reapplication.
Great. Thank you so much. Another question is, what is the time relationship between Clear and Brilliant or Thermage and fillers or injectables, before, after, and how long?
I do find, and we all know that if you do like Dysport or Botox or those, it's often nice to have that done prior to the treatment, because by doing so, if you're minimizing movement, we do know the neocollagenesis often works a bit better, right? We're not fighting it. So with the resurfacing lasers, I do like to have those done prior to the treatments. As for fillers, I don't think it really matters as much, right? You're obviously not going to want to fill someone while they're healing and swollen after a resurfacing laser. So if we're going to do any of that, I will often do it beforehand by perhaps maybe like 2 or 3 weeks. But I do filler on some of my patients that come from far away right before their Fraxel treatments. And I know there's a bit of a debate out there on if that's appropriate or not, but I will do that before my Fraxel. And then if I were to do a toxin as well to optimize their visit, I would do it after the resurfacing laser. But knowing you got to be careful, right? Because there is heat and swelling. So you have to be careful of the diffusion of that toxin.
Great. Thanks so much. What considerations do you need to make for Thermage or Clear and Brilliant with isotretinoin therapy?
With, Thermage and Clear and Brilliant?
Yes.
So I believe there was something that was published saying that you want to wait at least about 6 to 8 weeks before you start any kind of laser treatments after Accutane. We know Accutane's in our system for about 30 days after the last dose. So if you wait about 2 to 3 months after, you should be able to, but I would probably recommend maybe starting at a more gentle setting. Maybe don't be so aggressive. For me, it's more doing like a Fraxel, which is much more energy, and being a little more conservative with that first treatment.
Okay, great. Can you do Thermage and then a Clear and Brilliant treatment consecutively in a single day?
Oh, absolutely. I'll do it even consecutive with the Fraxel. What I'll do is I'll numb the patient, and then I'll do their Thermage, and then I'll follow with the Clear and Brilliant right afterwards.
Perfect. How often do you recommend Clear and Brilliant, and at what intervals?
I tend to kind of leave it up to the patients. I'm not someone that recommends set schedules of things. So you can safely do it every month. I think that's a reasonable way to think about it, so patients don't feel like they're in that often. So you could do a series of monthly treatments. Some of my patients just want that bolus. They want to get started because they just haven't done anything. So they'll come in and do a series of 3 month to month. Or I have some patients that come in kind of quarterly, the way they think about getting a facial or Botox, where they just need that pick-me-up every 3 or 4 months, and they'll do it that way.
Great. For Fraxel, I was unaware that I can treat reds with these wavelengths. Is it really that good for underlying reds?
I wasn't really talking about Fraxel in that way. I was talking about it more in the Clear and Brilliant aspect of it. Just the way I saw that it would just improve that overall, almost like irritated, flushed look. Is it equivalent to a vascular laser such as a Derma-V or a V-beam? Absolutely not. That's a whole different thing. But what I was looking at is more that KP rubra look, right? That patients have on that cheek where they're not really red, but they have it just out there. I found it actually helped it in a way that I was not really expecting it to do so.
Thank you. Why do you like Fraxel versus other thulium 1927 lasers on the market?
I like it for its power. So I think I get asked this quite a bit. I know a lot of the other thulium lasers, they talk about the delicacy, right, of the power, the beam widths. And just that delicacy allows being able to target post-inflammatory hyperpigmentation or melasma with minimal downtime, right? You have much less of that brown, like scaling and dirty sandpaper texture to your skin. And I think that's great. However, I find that with Fraxel, at least I have the option to dial down the energy if I wanted to. Yet, if I wanted to truly target actinic keratosis, significant photo damage like the patient that I had, I can really dial the energy up to get that. And I don't find that I can truly do that with the other versions on the market. I mean, that's a personal bias of mine, but I think I just have more breadth and versatility with my thulium and my Fraxel than I could with the other ones.
Okay, great. You have experience with both Clear and Brilliant Legacy and Clear and Brilliant Touch. What are the major differences that you've noticed between the two, and why might someone choose to upgrade?
Oh, I can't go back. I'm just gonna put that out there. At Mount Sinai, we have the old legacy, and it's a bit painful for me to use that when I'm teaching the residents, and I really, really want them to get the touch. I think it's speed, right? When you're like in your mode and you're going from patient to patient, the touch is just so much more effective and efficient. I don't have a lag where sometimes with that legacy, as you're going, you almost like hear the tracking and not firing, and you've got to go back. And sometimes with the laxity of skin, you find like, is the skin bunching on itself and you can't deliver it? Now the touches, I'm just going as fast as I would with a Fraxel. And it is just so much more efficient with such less time. And I almost find that it's more consistent in its delivery of energy as well, that patients are getting much more out of one treatment than they could with the other ones. The other thing is I like the option of going to use both wavelengths in one treatment. Again, customization, right? I like to know that I'm not being pigeonholed to say I can only do one or the other, or I have to use two consumables. Now it's one consumable treatment card, and I can choose what I want to do based on what I think the patient needs or what they're asking of me at that time.
Great. Why did you choose Thermage over other skin tightening modalities available on the market?
I like the mechanism and the science behind it. And I think so much of again, and I sound like a broken record, is that customization. I like that it is less painful. I like how quick it is. And I like when you think about the technology, if you look back at the original papers when it first came out, it is targeting the collagen fibrils, which we also know goes within the septae, within the fat. So there's a depth component to that shrink wrap effect, right? When you are really kind of getting that kind of tightening aspect of it. But the other aspect, I think, for me with the FLX was the tuning, that AccuRep technology where every single pulse is basically customized to the skin integrity and resistance with all that, with each delivery. And to me, that was everything. Because we know with these tightening devices, there is a lack of consistency where we expect it to always work better than it does. And we're always wondering why. So when the FLX came out with better comfort, is less painful, I don't numb my patients for it, right? And when you now have customization of tuning per pulse delivered with every single pulse for 900 pulses, to me, that was everything. So that, again, goes back to the science of it, the mechanism on how it works. And that's why I ended up picking that over the others.
Great, thank you. Is it difficult to sell your patients on Thermage? How do you communicate the benefits to your patients?
My patients actually love it. So when I do a cosmetic consult, I often talk about skincare. I talk about what can be done from an injectable. I talk about complexion. I talk about collagen in itself. And there's this idea of collagen banking, right? So when I talk to my patients about, is there a way that we can slow down aging in itself to some extent? Can we kind of keep us here in a worst case scenario and nothing else to slow down that loss of elasticity that we know we are losing every single day? And you don't have downtime, right? Like I think those words of collagen banking and no downtime treatments that are maintenance and maintaining to maybe never need plastic surgery or at least delaying for as long as possible tends to be a huge win for my patients. I have a lot of patients that are afraid of injectables. And so if they have something that can optimize their skin, they tend to love doing one of the resurfacing lasers and something that gives them a bit more firmness, and they can go back to their life. right? They don't have to take a break from anything, and no one knows they've done anything. To them, that's usually what makes them love that. And so that's why my patients come back for it all the time.
Great, thank you. And I know this from talking to you and also taking a look at your before and afters, but what are your tips for capturing the best before and after photos? And how do you get patients to come back to have their after photos taken?
So I always ask my patients, let's see how we're doing. Especially if it's the first time. I like to handhold a little bit more, so that they understand, hey, they didn't just spend all this money on a treatment and I don't ever want to see them again until the next time they come in and pay some for something, right? So for a lot of patients, their first time doing something, I will say, come back to me. Like Thermage, it's like 3 months in. Let's see how we're doing. See, are we making any progress? How are we feeling about it? Same with Fraxel. How do you look? Even with my injectables, I'll ask them to come back in because a lot of times they may not understand what they're seeing. And you may have to help guide them to appreciate the details of what's improved over time. As for the photos, it's tricky. I think there's no great, like there's some days I think the photos look amazing, and then there's some days I go, what's wrong? Let's repeat it again. But I think you have to be not so shy about moving their faces with them, but I always move their entire body so that you're going straight in and then 45, and then try to make sure that this apple, their cheek is the center. And then it's constantly, honestly, moving their heads. Patients just never keep their heads straight. Half the time their head's like this. You're like, no, I said straight. And they're like, it is straight. And you're like, no, it's not. But you're just guiding them, and you just have, it's practice, I think. And it's also knowing your lighting. And I would watch my staff so that I could train them. So I tend to hover when they're first new, and I will watch how they move the patient. And they're often so shy about touching the patient, and just guiding where the head should be and moving the hair and all of that. We use our iPad to do it. I find taking it in the EMRs that exist often degrade the quality of it. So we always take it on the iPad itself and then upload it into the EMR to maintain the pixelated quality that I'm looking for that high definition. But I think it's taking a moment to check the photos too before you start something, so that you can keep teaching your staff and making sure you like what you're getting so that you can consistently use them.
Thank you. And this is going to be our last question. I know a lot of people think I already have a Fraxel. I don't need the Clear and Brilliant. And I think at one point you were in that camp too. But what's the reason that where's the room for both? What's the reason to have a Clear and Brilliant and a Fraxel?
I mean, I think from just a marketing standpoint, there's the brand name, right? Patients know Clear and Brilliant. They often come in and ask for it. Clear and Brilliant's also a way that I talk about just dipping your toe into the world of resurfacing without fully committing to the downtime or maybe the stigma surrounding Fraxel, what resurfacing truly is. The power is also just much less, so you're already just not going to cause that much injury to the skin anyways, which is really nice for those who have hesitation that maybe should be getting a Fraxel, but they're afraid of what that process is. And this is a way to kind of ease them into it. Clear and Brilliant's also easily delegatable. So for me right now, it's all me. But at some point as I grow, I'd love to bring on other providers that I can also delegate my procedures to, so I'm not the one doing everything. So from a business standpoint, you get to increase your ROI in the same hour if you got more than one person that can do similar devices for you. Thermage and Clear and Brilliant are so easily delegatable that it's a way for you to have growth. And I think it's also just an easy thing because people know about it. They often just call for it. It's a very different market in itself, and it's an easy one just to get people to feel comfortable with, because it's still not, Fraxel's still very different than Clear and Brilliant at the end of the day.
Thank you so much, Dr. Lee. I'm going to turn it over to Janet, who's going to conclude the webinar tonight.
Thank you, Dr. Lee, for that fabulous presentation, and to everyone who joined us this evening. If anyone has any additional questions, please submit them to info@solta.com. That's info, I-N-F-O, @solta, SOLTA.com. This concludes our webinar. Thank you.
Take care, everyone. Have a good night.